I am excited today to talk to you, Matt, as the founder and CEO of ChronicCareIQ. And you and I have talked many times. You know that this is a subject I'm very passionate about, and the opportunity to provide better care coordination. And ironically, you've created a tool and a methodology to do that. And what was the genesis for creating ChronicCareIQ?
Yeah, well, I found myself, I guess being a wild and crazy single guy at age 30 that lost 50 pounds, wound up in the emergency room, was emaciated, didn't have enough energy to walk around the block, and couldn't sleep a full night without my body cramping and waking up in excruciating pain. So it was at the emergency room that I found out that I was days, if not hours away from being in a coma. And that's when I learned I had type 1 diabetes. And I immediately shifted my career from being in Fortune 500 and enterprise software sales towards medical software. And so I just wanted to be closer to medicine. As I did that, I built a successful electronic medical record company, but I never forgot, and I still feel it, especially when I hear patient stories, that period of isolation I had post-discharge, post-diagnosis, being at home and not knowing what's important and what's not important.
You have a chronic disease at that point.
I have a chronic disease. I don't know if I have high blood sugar, if I'm actively taking hours off the back end of my life, and I didn't want to alarm my family, and I just felt very isolated. And I think as I grew in my medical career with electronic medical records and then telemedicine, I just realized that mobile technology now has the ability to enable the patients to reconnect to the doctor's office in a meaningful way. And I was standing at Home Depot one day watching a woman check her smartphone. I thought, maybe the idea here is that patients should update the doctor rather than the doctors do more things for the patients. If we could make an easy way for the patients to update the doctors, we could eliminate a lot of the problems, I think, that we find with chronic patients and fragile discharges, so that it's the patient's responsibility to update the doctor. And if we do that and make that easy for them, they'll do it. And I felt strongly about it because I was that guy.
Well, and what's so exciting to me is the industry has talked about patient engagement for years and how to attain it. And you've created some tools that make that very easy. Easy on the user end on a patient side, but easy on the user end from a physician practice side. So talk a little bit about the tools that you do that, and how do you connect that patient and that practice?
Sure, well, thanks for asking. As a patient and as somebody that worked in medical technology, I built a very large EMR, and I wouldn't log into my own portal. So we knew it had to be something simple. And what does everybody do when their phone buzzes? They look at it. So we push questions to the patient related to their medical condition, and they can respond very simply, very quickly. Their responses appear in the office on a dashboard that's color-coded, and they're not predictive responses that this patient needs to go to the hospital. They're just saying that this patient, out of all the patients that are submitting their responses, probably is worthy of your attention. And then because it's color-coded, it's very simple to identify those patients. And then we leave it up to the medical assistant, maybe the nurse, to click on that patient, see what's causing those alerts or what's causing those trends. In addition to that, we give a little social reinforcement, because if a patient who's been enrolled doesn't answer their questions, decides to skip a day or two, then it will send an alert to what we call the patient advocate, and that might be the adult child of a senior parent or a spouse or something. And there's just a convergence of things happening. With most people do have smartphones now, or at least someone in the house does. The patient engagement, the attention and focus on how are we going to do medicine better. And it seems like we've made the medical industry, the doctors, the administrators, the whipping people of this business. And healthcare's been something that they're constantly trying to do, to people and for people, and we're now changing it into something that we can do with those people that need that help.
Sure.
If your phone buzzes you and says, "Did you check your blood sugar this morning?" you can say yes or no, and then it might ask you, "What was it?" It just depends on how well controlled you are and what your clinical protocols are.
It's been very exciting for us as MedAxiom to begin to connect you with our members, because we're obviously very passionate, and we think this fits perfectly in the cardiovascular space. But you just don't do this with cardiology practices. You've got a large cadre of users around the country. Would you talk a little bit about where you're at right now in terms of number of programs or number of users, how, the size of CCIQ adoption across the U.S.?
Sure. Well, we started 2016 with 3 customers, and we ended 2016 with over 40. Today, we push over 150,000 data points a week to chronic and fragile patients from Hawaii to Maine. We're deployed by the largest health system in the state of Maine, the largest health system in the state of Mississippi. We've recently signed a global contract with HCA, and we think that by the end of the year, we'll have 4 of the 5 largest health systems on board.
Fantastic, fantastic. Just, any words of advice as an organization is considering, should I do this? What's your 60-second elevator speech in terms of why they should take a serious look at this?
Well, I'm passionate from the patient perspective, because we see those patients in medicine every day, and we forget that this is a 72-year-old going home, taking care of a spouse, worried about her children and her grandchildren, or whatever the case is. It's a very lonely place. And to offer them that connection, it's a tremendous benefit, because that's what I remember most about being in that spot in my time of life. I would say trying to do chronic care management without something that enables the patients to do some of the heavy lifting, without automation that's going to track all of the minute details that need to be tracked for billing, that you'd probably be really frustrated.
Absolutely.
So I would look for...
I've seen many organizations fail at that. Try and do this on their own and build a system from within, and cannot be done.
Yeah, and unfortunately in the market, there are 2 solutions. You can do it yourself, which is death by 1,000 cuts, or you can hire an outsourced call center, which takes all of the money except they let you keep the copay. So, but in the meantime, you own all the risks. So we're proud of our spot in the middle that charges a flat fee and enables the doctors to make it a profit center, so that they can provide it to the patients who really need it.
Do you have any feel for, on a typical cardiology practice, say per cardiologist, what this could mean in terms of a typical adoption rate, how much chronic care management fees could add in terms of additional revenue for work they're already doing?
Sure. Well, work they're already doing is one thing. That we have a call logging piece that meshes up the caller ID logs from the practice and the time that the nurses are spending on the phone with the software, so that we can actually capture that phone time that most people don't get. But to answer your question directly, I think a good average per cardiologist is 300 patients per cardiologist is a good panel after a year.
Okay, that's a pretty good income stream. Again, that wouldn't be the sole reason to do this. I think the real reason to do it is all about patient quality. So thank you very much, Matt, and I really appreciate that you developed this product, because it's you're filling filling a void that needed to be filled. So I'm sorry that you had to go through your own traumatic experience to get there, but sometimes that's what it takes to stimulate innovation.
I believe I was called to be in the medical business, in fact.
Fantastic. Well, thank you.
And I appreciate you thinking so highly of us.
Okay, thank you very much.
Cheers.